G'day everyone, welcome back to the channel. So in today's video, I want to show you guys a really versatile and simple knee taping technique that can help a lot of different knee problems. I think clinically what we find is that despite there being a whole range of different diagnoses for knee pain and knee dysfunction, there's often some common themes or some common threads that link a lot of those issues together that suggest that a lot of knee pain isn't necessarily a new thing compared to something else or a different thing, but a lot of knee pain can tend to be an expression, a different expression on the same theme. So hopefully this really simple knee taping technique can help give you some short-term pain relief or some short-term functional gains so that you can go about living your life, maybe get through that game that you need to, get you up for the next one, or just help improve how quickly your knee pain feels better. Now, it's really important that when we're talking about knee pain, there's one really simple mechanical issue that we see that links a lot of them together, which we want to try and tape for. So we need to understand this to understand why we're going to tape this way. So when we look at your squat, what we see a lot of people do is a lot of people tend to squat who have knee pain. They tend to have their feet turned out a little bit, or when they squat, their knees want to come in. So we see this pattern of a rotated out foot and a knee that translates inwards. We see the the arch tend to collapse, and that hip can close down a little bit when you're squatting. And ideally what we want is with your feet relatively straight, when you create this knee out external rotation force, you'll see that the arch in the feet will tend to lift and the knees will tend to translate out with your hips engaging. And when you squat from that position, we often see that the knees will stay in a relatively similar position or a similar plane. They won't tend to wobble, the feet won't turn out, your heels won't lift up, and it stays relatively stable. So whether you've got something like meniscal issues or knee arthritis or patellofemoral joint pain, if you see this pattern develop, we want to try and sort of tape to prevent that a little bit. And what we see at the knee is when the shin's pointing one direction as the knee tends to want to rotate inwards. So we want to tape to try and support that in a better shape. We want to create some relative external rotation at the joint to allow it to function more normally as opposed to that sort of valgus knee that we see a lot. Now, obviously, if you're someone who has sensitive skin, you can use the white tape underneath to help with that. It also makes it a little bit easier to take off. Again, if you've got hairy legs, good luck with this because you might lose a few hairs on the way out, but the white tape can make it a bit easier. And what I would suggest is when you're taking the tape off after maybe 2 or 3 days, then take it off with the grain of the hair. So for me, my hair obviously goes down. So when I'm taking it off, I'm not going to be pulling up as I take it off. I'm going to be pulling down as I take it off. It just feels a hell of a lot nicer. It's a lot easier to bear these precious hairs. So basically, as you said, we're trying to create that rotational force. And what I like to do is the tape's basically going to go from sort of the more outside part of the top of the shin towards the inside part of the bottom of the thigh. But we're going to try and create some relative sort of rotation at the knee. So keeping my thigh relatively still, I'm going to try and rotate my shin inwards to allow, I guess, essentially what we're trying to do is we're trying to bring the tuberosity at the top of the shin more in line with the kneecap itself. And again, when we do any type of taping, we want to make sure that you do a test and a retest before and afterwards so that you don't have to guess whether it's helpful. So if you stand up and do those squats before you tape, take note of when your pain kicks in, because we also want to make sure that we tape you at the angle that hurts. So for example, if you squat and you feel your knee starts to hurt here, then essentially we want to make sure that when you tape your knee at a relative angle so that you're giving support at the moment that your knee mechanics might break down and cause some pain. So basically what we're going to get you to do is, again, what I like to do here is pull a bit of tape out first with the non-sticky side down. Just measure from just a little bit further down from the bump at the base of the knee here, and then measuring up towards the inside of your thigh a little bit. And that just gives you a good distance so you know how much tape to use, so you're not having to guess. And it gets a bit awkward if you're doing it while you're taping. So basically what I want to get people to do is I normally start with the leg relatively straighter. We want to tape from just outside that shin, the bump at the top of the shin, and then we want to come up on the inside of the kneecap. So we're not taping onto the kneecap, we're coming inside the kneecap and coming up in that position. So hopefully you can see there, it starts on the outside of the shin, and then it wraps up and around on the inside towards sort of where the adductors are. Now, if you've got the white tape, this one's just a gentle, I guess, initial tape to give the rest of it something to stick to. And forewarning, this doesn't necessarily look like a pretty way to tape. So if you're into that sort of thing, obviously you might have to put up with it for a little bit. But what we want to get you to do next is, now that we've got that first bit of tape down, we want to bend your knee to the position that pain might come in when you squat. And what we want to do here is, once the tape's attached, we want to grab your calf, grab your shin, rotate it inwards as far as you feel comfortable, and then pull the tape along the inside there. So have that internal rotated force at the shin, putting some tension through there, and then taping down to hopefully secure that in a better position. So we'll do a couple of these just so we get enough sufficient force here. And these subsequent pieces of tape probably aren't as long because we're trying to take out some of the slack, so they might come up a little bit higher. So by making them a little bit shorter, it just makes it a bit easier. So again, starting at the same point, create some of that rotation. What I like to do as well is, once I've created some of the rotation, is to pinch a little bit of the skin just to add a little bit of tension there. And that's essentially all it is. So it's just a strip of tape, or a couple of strips of tape, from the outside of the shin all the way up onto the inside of the thigh. And then what we tend to find is, when you squat, you should feel like you all of a sudden get a little bit more support in the position and in the range that often hurts. So again, you can keep coming back to this. If you feel like you're not getting enough support at the right time, then it's pretty easy just to jump down again, add another strip of tape, try and pinch the skin a little bit so that you can tape over the top of that, just to add a little bit more support. But you should find that that hopefully helps restore some of the normal loading to the knee, give you some symptomatic relief while you're working all the other things like stiff ankles, tight hips, weak hips, tight hip flexors, low back dysfunction, all the things that might be causing that knee pain in the first place. So again, this tends to stick really well, but if you're someone who sweats a lot, or you need it to stay for a long time, you can put some tape across the bottom and across the top just to secure that in place, so that it keeps allowing you to do the right thing. But as I said, if you've done the right thing, when you stand up again and squat, if you've rotated that tibia enough, create enough tension on the inside here to hold it there, you should notice an immediate improvement in your pain. If not, then obviously speak to someone, get someone else to do it for you, because sometimes it's a bit awkward if you're having to twist it, pinch it at the same time, but it can be done. But again, it should feel like there's an extra bit of support there when you didn't have support before. So please let me know in the comments down below how you're going with that. I'm happy to reply just to give you some pointers on how to do it. But as always, if this is helpful for you, please consider leaving a like and subscribe to the channel, just so we can grow and put out more videos like this. But in the meantime, thanks for joining us. I hope that helps, and we'll see you next time.